Welcome, everybody, to a very special series, COVID-19 Wellness Series, where we bring you some very special guests who speak about how you can manage yourself physically, mentally, during this crazy, unprecedented health crisis that is COVID-19. This is put together, these very special COVID-19 Wellness Series are put together by Serve Canada in association with ARRA Arts, two wonderful organizations that really do great work globally and within the communities as well throughout the world. This is also an association in support of Trillium Health Partners and the Trillium Health Partners Foundation. So sometime during the course of this program, you'll see at the bottom of your screen a link, an email that if you would like to donate to this amazing organization, Trillium Health Partners Foundation, you may do so. They provide world healthcare for a healthier community right here in the GTA. They have three hospitals, the Credit Valley Hospital, the Mississauga Hospital, as well as the Queensway site. We're going to start the program now. I want to welcome the host of the series, as well as the founder of ARRA Arts. She is quite exceptional. Anu Srivastava has done so much great work. You know, she's a successful entrepreneur, a business person, but at the same time, she believes in giving back, as does her family in the community. And they do give back in such a way. She is so engaged. I am so blessed to call her my friend. You know, whenever she comes up with all these great initiatives in engaging the community, I am so happy because that's just what she does and her family does. Please welcome the host and the founder of ARRA Arts, my dear friend Anu Srivastava.
Thank you so much, Jake, for the very, very kind introduction. Thank you. Foremost, I would like to bring greetings from Mayor Bonnie Crombie for endorsing and supporting the COVID Wellness Series.
Mayor Bonnie Crombie here from the great city of Mississauga, sending my best wishes to all the organizers and participants attending the COVID-19 Wellness Series hosted by Serve Canada and ARRA Arts in collaboration with Trillium Health Partners. COVID-19 pandemic has brought so many uncertainties to our lives and has disrupted our way of living. It's okay to not feel okay during these uncertain times. It's important to stay active and stay connected mentally, physically, emotionally, and spiritually. The COVID-19 Wellness Series is an opportunity for people to de-stress and take care of their mental health and well-being. By showing up at today's session, you are making your mental health a priority, and you should be very proud of yourself. Brighter days are ahead. In the meantime, stay healthy and stay safe.
Hello, I'm Nina Tangri, your Member of Provincial Parliament in Mississauga-Streetsville. On behalf of the Province of Ontario, I would like to recognise Serve Canada and ARRA Arts for hosting the COVID-19 Wellness Series of Workshops in collaboration with the Trillium Health Partners. The COVID-19 pandemic has impacted so many of us with feelings of anxiety, depression and uncertainty, but it is important to know that help in various forms is available for all of us in our community. The 10 virtual workshops by Serve Canada and ARRA Arts talk about how to care for our mental health or wellness and other common health issues during the pandemic. We are thankful to Mississauga residents like Anu Srivastava who have taken the initiative to help our vulnerable populations through the COVID-19 Wellness Series. I would like to thank all of you for physically distancing and doing your part to combat COVID-19 and ask that you continue to please stay safe.
Welcome to the COVID Wellness Series. Serve Canada is a health and wellness organization. It's a not-for-profit organization. And ARRA Arts is a social wellness organization. And when the lockdown happened with COVID, sometime in March, the thought was that we would want to do something where it would help our community and our people to come out of this uncertain circumstances and the situations that we are all going through. So, the COVID Wellness Series was the brainchild of these two organizations which came together, and the initiative was taken in support of the Trillium Health Partners. There are 10 online workshops that have been that we will be doing through these series. And we will have a range of medical doctors, the wellness experts on one hand, the allied professionals on the other hand, and also we will also have the traditional methods of yoga and meditation, and how between all these three things, how we can take care of our mental health and wellness, how we can take care of ourselves, our self-care, and we will be able to see through all the series of the 10 workshops, which kind of will walk us and help us through the COVID pandemic that we are all going through. So at this time, I am really, it's my pleasure and privilege to introduce Carole Sander. Carole Sander is a clinical social worker in ambulatory care in Credit Valley Hospital for the Trillium Health Partners. She also holds a recent appointment as a research investigator at the Institute of the Better Health at Trillium Health Partners. And besides that, Carole also holds a research and educator membership at the Center for Interprofessional Education at the University of Toronto. Welcome, Carole, to the workshop. And I'm actually going to jump to the first question. Can you tell us a little bit about your work at the Credit Valley Hospital?
Yes, thank you. First of all, I want to thank you for the important work you're doing, you and your team, Anu. And I'm honored to be here. Yes, I work in the ambulatory mental health services team at Credit Valley Hospital. And we are a team, an outpatient team. We're social workers, occupational therapists, registered psychotherapists, nurses, and psychiatrists. And Dr. Daw, who's part of your series here, leads our team. So we provide counseling to individuals, adults, from the emergency department at Credit Valley, inpatient mental health, and from psychiatrists in the community and physicians in the community. We work in mental health, a lot of depression, a lot of anxiety, and our program is a group program. So we do a mixture of supportive counseling and skill teaching. So that's a little bit about. We're now doing we're working on the telephone and virtual or telehealth, but before COVID-19, we were holding a lot of groups in order to do our work. We're a very supportive team of each other as well, which has been needed at this time.
So, Carole, one question I just wanted to know, that you said that you're specifically located in Credit Valley Hospital. Is there this outpatient team or the ambulatory team? Does it actually also go to the Mississauga Hospital or the Queensway site as well, or is it just totally in Credit Valley?
Well, that's a good question, Anu. I myself work with a team at Credit Valley, but there is a team associated with Mississauga Hospital, located in the nearby PCL building, and there's inpatient mental health at that hospital as well. And we do work together loosely as well. We're in the same ambulatory mental health service.
Okay.
So we have across the board many referrals, but we will often see people from Mississauga Hospital and vice versa.
So one of the questions I would have, Carole, is that during this pandemic in the last 6 months, are you seeing people who have been directly affected by COVID-19?
Oh, yes, we are. We see people really across the whole age gamut, from age 18 to someone in their 70s that I'm seeing. right now who have all been affected. I would say most people have been affected in different ways, kind of exhibiting symptoms of depression, anxiety, loss, worry, a lot of suffering, I would say, regarding the stress of this time and the losses that people are experiencing in different ways. Whether it's the loss of face-to-face connection, we see people who can't visit their elderly parents, or people who are faced with job loss and financial loss is a big worry for people. And people are feeling very isolated and lonely. We've come across that as well. And there's a lot of uncertainty which people are facing. We don't know how long this is going on for. And more recently, we're seeing more kind of a more of a fatigue, a pandemic fatigue and depression. No one knows how long it's going to be. And then there's a lot of confusion people are experiencing because of the mixed messages from government, the mixed medical messages. So I know, and people struggling with health concerns, but also their business concerns. So yes, I would say that it is something that we're really dealing with. Most of us are dealing with it with our patients and ourselves and each other.
Carole,
so these patients that you're seeing, are they mostly coming to see you physically, or is it that you are seeing them by phone or by virtual phone calls?
Yes.
How is that happening?
Well, since about March, we stopped our group programs when the pandemic was called and just before, and we're seeing people. Most visits are happening over the telephone or virtually through telehealth. And only recently have some people started to come in slowly. So that's also happening. But that, again, was a big adjustment for us when we were used to meeting with people individually and in groups, in person, I should say, and in groups. So it was a big change. And a lot of people love our group programs, so they really were, finding it difficult also just talking on the telephone with us. And for us, it was also isolating. We were used to groups that had a certain amount of vitality. Anyway, we've been doing what we can, providing the short-term telephone counseling or through telehealth or virtually.
Well, let's talk about, Carole, you spoke about, they love the group sessions. You talked about engaging in other ways, I suppose the new norm. How are you helping and with counseling and so on with these individuals? I mean, this is all new to them. This is all new to you. And just maybe speak about how you're engaging them and helping them.
Yes, we basically we provide a combination of supportive counseling and skill building to cope with anxiety, depression, grief. And we have been doing it in the group format, but so we've been doing something similar, but over the telephone, depending on the person and what the needs are. So we use a cognitive behavioral therapy. We also use another DBT therapy focusing on distress tolerance. But in the cognitive behavioral work, we try to work, help people to acknowledge how they're feeling and to set small daily goals to improve their functioning and self-worth. So that is the more cognitive behavioral approach, where people are, we try to help people set small goals so that they can be involved in activities that give them pleasure, achievement, and connection. And in order to hopefully improve functioning, feelings of self-worth, and being active and having small goals and activities does a lot toward improving mood. It very, very helpful, helping to make the mood more positive. And the small goals also help build structure and routine, which many of us have lost through this time of COVID-19. What we're seeing is people tend to isolate themselves and possibly numb out by not doing very many activities, watching Netflix, no exercise, perhaps drinking a little bit too much. So we are really working toward getting people back into building a routine for themselves. We use grounding exercises a lot for anxiety, where people are really working at being aware of their senses. And like Dr. Dawes' talk focused on self-care, we really try to help people improve their own self-care, getting the right sleep, eating well, pleasurable activities, considering mindfulness or meditation. We do a lot of mindfulness in our group and previously in our group programs. So some of us have bringing it into more of an individual focus in our work right now as well. So it's a combination of approaches.
So, Carole, would it be fair to say is more in the counseling of all the people who would come to the hospital? And when we talk about that, does your group, do they actually collaborate with other programs in the hospital or maybe in the community, like all the counseling programs and things like that that you guys might have?
Yes, most of the programs are being held through a virtual format right now. Within in-house, we have an eating disorder program. We have concurrent disorders, which deals with addictions, and many people will attend ours and the concurrent program. There's a child and adolescent program as well. These are all in-house, and we work with each other quite well if it looks like someone needs some other service. In the community, we work closely with also these people. The community agencies are all virtual as well at the moment. We work with PARC, which is an addiction service in Peel. Peel Family Services, Catholic Family Services, we find are really good resources for individuals for longer term counseling, but also for couple and family work. The Canadian Mental Health Association has also got great services available to people. And we're finding grief is a big one these days too. With COVID-19 and the losses involved with family and our health, we work with Wellspring, and Canadian Virtual Hospice is also a really good resource in the community that has so many supports listed for people. So dealing with loss, dealing with grief, the stress of loss. So I would say we work with many resources, both in-house and outside.
The counseling programs that you would have, are they the same probably in the other hospitals as well? Like they would follow the same kind of guidelines, or would, let's say, the Credit Valley counseling program would be different than, let's say, another hospital?
Well, many hospitals in their mental health, I can only speak really for my own, but I know that CAMH and some other hospitals offer the cognitive behavior therapy, and also the DBT, which I've mentioned, which really you're learning a lot about distress tolerance, plus many other skills. But yes, many hospitals do. I can't speak knowledgeably about what they're offering right now. But I know most have all gone to a virtual format.
Right. I know, Carole, you've already talked about your resources that we can go to. If there's any more that you think that you need to add to, maybe there's
Yeah,
more that you want to let us know.
sure. Well, because we're working with a virtual format, we've done a lot of like emailing things back and forth to patients and families, and look at certain skills and readings, and then we discuss them. Things that we would do in our group program. But there's, I would say, well, there are many, but there were two really very helpful workbooks that came out recently in response to the COVID pandemic and the challenges. One we find very helpful for people is, it's called, I will list it and I think you might have the link there, Tolerance for Uncertainty, a COVID-19 workbook. It's a guide to accept your feelings, tolerate distress, and thrive. And Dr. Nagasawa has put this book together, and it's accessible at baypsychology.ca. baypsychology.ca. And another one is the Coronavirus Anxiety Workbook, a tool to help you build resilience during difficult times. And the wellnesssociety.org is where you can find that. So these two workbooks have been really helpful to people who are feeling isolated and distressed at this time, so anxious, depressed. So I would really suggest they would be very helpful for people to have a look at. Also, mygrief.ca is very helpful. It's a good resource as well. And that's also through canadianvirtualhospice.ca. There's a resources page also on the virtual hospice, canadianvirtualhospice.ca, which has many, many, many links on COVID-19. So, and many of these workbooks will suggest ways to handle anxiety, grounding techniques, and some of the activation stuff we talked about earlier. So those are helpful. I think I provided you with links too.
Yes. No, thank you so much, Carole. I know that you all truly are our health heroes and doing such a wonderful work for all of us over there. And I know that a lot of anxiety, a lot of stress has actually come through to our frontline workers, to people like you. So, how have you and your team been dealing with such stressful times, not only at work, but at home?
Yes, that's a very good point. I have to say the truth is it has been very difficult and challenging. But I have to say what I've been so grateful for are that we are very supportive of each other. We work closely together, and it's a great team. People have really been there for each other at this time. We are more isolated because we're doing a lot of phone work and virtual work. So we often arrange to meet for lunch and breaks, and supporting each other as best as we can. We also developed some peer consultation meetings weekly to discuss our work with each other as well. So that is a new development for us. There's also resources for people, for frontline staff. Many of us have been, well, everybody is on Zoom these days, but there's been a lot of resources come through for frontline workers there as well. Many of us have attended various mindfulness series, which were available at Sick Kids. And on an international basis as well, people from around the world in different areas of meditation or mindfulness, specifically for healthcare workers. So that's been quite helpful as well, kind of reaching out in that way. But yeah, it has been a challenge.
Yes.
Wow. Carole, I was just you've given some incredible resources, as well as you've talked about some resources even for the frontline workers and for the staff. Just before we wrap up, any other resources, any other insight that you can provide that would be helpful, useful for our frontline workers and for the staff, so they can continue with their lives in a very healthy, both physically and in a mental state as well.
Oh, okay, sure. Um, I've been assisting Canadian Virtual Hospice recently. They're developing modules. We're developing modules for healthcare workers. And there's a series of 4 modules that should come out shortly. So this is another attempt to help the workers looking at issues frontline workers are experiencing and the grief and trauma many people on the very front line are experiencing and facing with losses. And I could also say people, nurses, doctors, feeling very grief-stricken when family members have been dying and or the patient dying and family members haven't been able to visit. So they've been trying to connect people by telephone and laptops. That's been very, very hard. So I think that the increased support that's happening now is important. Also, I just wanted to mention I attended a workshop, Sick Kids, this past week, which Dr. Ronald Epstein was presenting, and his team, on mindfulness, and also that how important it is to acknowledge the distress we're facing, but also it's the important what we're doing right now, televising and speaking about this is very important as well. It is an institutional and a workplace support and support from the community, and that's also really important for people facing these crises right now, for the healthcare workers, and also to take action in their own hospital or institution if it looks like they need to speak up about things as well. So both are important. And there's a book I'll recommend. Dr. Epstein wrote a book called Attending in the last couple of years, in which he writes about healthcare professionals and the challenges they're facing. This is prior to COVID-19, but it is an eye-opener. So I would recommend that. Well, and I very much appreciate
more. Sorry, Carole, I interrupted you. Go ahead.
No, that's okay. I was saying I very much recommend his book, Attending, which looks at different challenges working in healthcare prior to COVID-19, but they then are quite escalated at the moment due to COVID-19.
Of course. Listen, on behalf of all of us, Serve Canada, on behalf of ARRA Arts, on behalf of Anu, myself, our Y Media team, pretty well, Carole, everybody around the world, we thank you and Dr. Daw and everybody else, all our incredible frontline healthcare heroes. They are our heroes for all that you're doing in keeping us safe, keeping our family safe, and you folks are the one that are risking your lives in taking care of all of us. So we cannot thank you enough. And may God bless you and your families and your teams. So thank you again. We've been speaking with Carole Sander. She's the clinical social worker in ambulatory mental health services at Credit Valley Hospital, which is one of the 3 hospitals that is under the umbrella of Trillium Health Partners and supported by Trillium Health Partners Foundation. You have the Credit Valley Hospital, the Mississauga Hospital, and the Queensway site as well, that provide local and regional services in all healthcare capacities, providing world-class healthcare right in our community. Carole, thank you again for being a part of today.
Thank you.
Thank you. Again, you have been watching our COVID-19 Wellness Series that are put together by Serve Canada in association with ARRA Arts. And I'm going to now turn it over to our host, Anu Srivastava, who's going to wrap it up and say some very special thanks, including the wonderful team at Y Media. Over to you, Anu.
Thank you so much, Jake. I truly too echo your sentiments that how wonderful and how grateful we are to all the health heroes, the frontline workers, um, Carole Sanders, you, your team, Dr. Daw, his team, all of you. Um, we are so grateful to all the wonderful work that you all are doing. And I have to thank our moderator, Jake Dheer, who is very, very active in the community. He is in the board of directors for the Trillium Health Partners Foundation, and I'd really like to thank him. And last but not the least, I'd like to thank our technical partners, our Y Media team, Yudhvir Jaswal, Preet Jaswal, Gurpreet, and Angad, and the whole team. Thank you so much for all the wonderful work that you are doing so that people can actually view these COVID-19 Wellness Series. Until next time, thank you.